So with that, I'll introduce the first speaker, Dr. Cornelia Laule. So Dr. Corree Laule is a physicist, an associate professor in the Department of Radiology and Pathology and Laboratory Medicine, a vice chair of research in radiology, and an associate director of the International Collaboration on Repair Discoveries at the University of British Columbia. She is interested in understanding the microstructural and pathological determinants which govern T1 and T2 relaxation measures in the central nervous system tissue. Her primary areas of research are multiple sclerosis and spinal cord injury, and she has extensive experience in imaging both in vivo and postmortem brain and spinal cord, with emphasis on characterizing myelin. She's also passionate about science communication and leads initiative to increase diversity in STEM, emphasizing women and Indigenous people. So with that, the floor is yours, Dr. Laule.
All right, great. Let's see if I can share my slides here. Okay. Does that look all good? Yeah, okay, I'm getting some nods. Okay, perfect. Let me just minimize my face so I don't have to stare at myself while I'm giving this presentation. So thank you very much for the introduction, and thank you for the invitation to present today. I'm really happy to be part of this. I think this is a great initiative, and hopefully this type of session will become an annual meeting, as I think bringing everybody together virtually is really fantastic to kind of discuss important topics like this. So I wanted to begin with a little bit of a background about multiple sclerosis. My talk is going to be focusing on myelin and water imaging work in MS. I will throw in a few other disease applications at the end, but mainly focusing on MS. So to give a bit of background about multiple sclerosis, this is a disease that affects approximately 100,000 Canadians, 400,000 Americans, and over 2.3 million people worldwide. MS-related healthcare costs are extremely high. I couldn't get any statistics for Canada, but for the US, it's more than $10 billion annually. So very high healthcare and socioeconomic costs associated with the disease. It's actually the most common non-traumatic cause of disability in young adults, and it tends to affect females 2 to 3 times more often than males. The primary target of damage in MS is myelin, but other tissue components in the central nervous system, such as axons, glia, also get affected, and there's associated inflammation and many other things. There is a genetic component to the disease. So, for example, if you have identical twins, if one of them gets multiple sclerosis, the other one has a 30% chance of getting MS, which is much higher than a regular sibling, but it's not 100%. So there's this genetic component, but it's not all genes. And so really at this point, the ultimate cause and triggers of multiple sclerosis are still not well defined. And so why would we want to maybe use MRI to try and learn about MS? I mean, there are other ways that we can learn about multiple sclerosis and CNS diseases in general. So, for example, you can do human histological studies, and there's clear evidence of demyelination, remyelination, as well as axonal loss in these types of studies. But one of the challenges is that these types of studies don't provide any information about timescales. They're also typically from very advanced disease, so people that have had multiple sclerosis for 30 or 40 years. And so you really don't get any information about acute changes that are happening in real time or in very early phases of the disease. Now, we can use MRI to study multiple sclerosis and look at changes happening over time. So, for example, here, this is a kind of typical conventional image which shows a lesion, and you can see this lesion getting smaller over a number of different scans that happen over a period of months. But even with this type of scan, we can't tell what's happening inside. We know there's all these different things that could be going on, like axonal loss, changes in inflammation, myelin damage, myelin regrowth, but we really don't get a lot of information. And so this this fact that conventional MRI has this low specificity and also poor sensitivity for non-lesional disease. So the lesions are obvious, you can see them changing in size and shape, but there's also disease activity that's happening in the more normal appearing areas of the brain. And so this is where advanced imaging can come in to better assess the damage that's happening in the pathological changes. And so there's a whole slew of different candidate advanced MR, quantitative MR methods, many of which we've heard about these over the last few days already. And this is not an exhaustive list. There's also non-MR ways such as PET. But for today's talk, I'm going to be focusing on Myelin water. But I just wanted to highlight that there are, of course, many other ways that we can characterize damage that's happening. And so a bit of a background about, conceptual background about the method. So if we look at a cross-section of an axon, a myelinated axon, you can zoom in and you can see there's kind of some different structure that's happening. And if you create a schematic that kind of represents the different lipid and protein components, you can see there's, a number of different types of lipids. There's also a number of different types of protein that go into making up myelin. But then importantly for us in the MRI world, there's also water. So there's water that's trapped inside and outside of this myelin bilayer. And this is the water that we're measuring when we're talking about the Myelin water method. And so how are we able to do this? Well, the property that we're using is the water's T2 relaxation time. And so if we again kind of conceptually think about these different physical spaces, if we have water molecules that are trapped inside the myelin bilayer, they're in a more tightly confined space, and this leads to a shorter T2 time. Whereas water that's inside the axons or outside of the axons or in the ventricles, for example, has a less tightly confined space, and this leads to a longer T2 relaxation time. If we're going to do an experiment, and this is one way of collecting myelin water imaging data, this is going to be a bit of a kind of intuitive explanation of how we get out our myelin water component from our experiment. So if you look at the signal as a function of measurement time of a homogeneous environment, so a bottle of water, what we see is that the signal decays as a straight line. And that's because there's a single T2 component in this water. There's not water in different physical spaces, and it's all just kind of relaxing, losing its signal at the same rate. If we do the same experiment on a heterogeneous environment, such as brain or spinal cord tissue, what we see is that this doesn't decay as a straight line. And in fact, you need multiple straight line components to try and characterize how the signal is changing over time. And that's because there's multiple T2 components. Now, there's different ways to extract out the number of exponential components that are contributing to the signal. You can use predefined number of exponentials, some of Gaussians, and that's a whole separate talk in itself. But at the ultimate end of the day, one of the ways to represent the different T2 components is something that looks like this. So this is a T2 distribution from white matter, and you see these different peaks here, and each peak corresponds to water that's in a different physical environment. And then the area underneath each peak corresponds to how much water is giving rise to that signal. So we have this short T2 time, which is from water that's inside the myelin bilayers. And then we have an intermediate T2 time, which is around 80 to 100 milliseconds. And this is water that we believe is in the intra and extracellular spaces. Now from this, we can calculate what's called a myelin water fraction. And it's just the relative amount of signal of the myelin water to the total signal in the T2 distribution. And then if we display that myelin water fraction at every single pixel in the image, we can create something called a myelin water map. And this work was pioneered by my former PhD supervisor, Alex McKay at UBC, alongside another scientist, Ken Whittall, who was involved from the very beginning. Now, so we have this myelin water signal that we can determine from in vivo studies, but as with any method that's proposing to be specific or sensitive to tissue components, it's important to do histological validation work. And so this was the first study here that was done comparing, and this is more of a qualitative study by Wayne Moore, a neuropathologist I work with at UBC, the MRI signal for myelin, so the short T2 component, to different types of staining. And this is a hemisphere from somebody that had multiple sclerosis. And the arrows are pointing at different lesions or bright, obvious areas of damage. And then you can see, if you look just kind of, qualitatively, the areas where the arrows are on the short T2 component and the proton density correspond to areas of reduced luxal fast blue, which is a myelin stain, but also show reductions in the Bielschowski stain, which is for axons, and different types of protein components in the myelin, such as the CMP. So you see a good qualitative correspondence, and this work was done at 1.5 Tesla quite a number of years ago. But since then, we've moved forward and done more sophisticated and quantitative correspondence work using our 7 Tesla preclinical scanner. Similar sort of picture here where the arrows are pointing to focal lesions, and you can see qualitatively on the myelin water image, the areas that are dark where the lesions are correspond to less staining on the myelin stain. And then if we do this a little bit more quantitatively, comparing the myelin water fraction to luxal fast blue, which is just basically how blue it is, we see a good, strong quantitative correspondence between the two measures. So we feel quite confident in making the statement that myelin water is indeed related to staining for myelin in central nervous system tissue. So I'm going to go through kind of some different sort of highlights and interesting things that we've learned about multiple sclerosis using myelin water over the last number of years. And so one interesting thing that we see is that we can see decreases in the lesions, which we've already seen in the postmortem tissue. And so here's one example. We see these lesions, and then those areas correspond to absence of signal on the myelin water image. So we say these lesions have little or no myelin. But what's interesting is that we noted there's quite a heterogeneity between different people. So the second case here, it's they look very similar on the proton density scan. But if we look at this person's lesions, you can see they're reduced in signal, but they're not nearly as dark as the previous case above. So you see heterogeneity between people, but we can also see heterogeneity within a single subject. So highlighting again on the flare and the post-GAD T1, you see this bright lesion here, which corresponds to some reduction in signal on the myelin water image. And then right beside it, we have another lesion, which looks similar to on the flare and the T1, but not nearly as reduced as the first lesion on the myelin water scan. And so this was just a single snapshot, but perhaps these differences could reflect differences in lesion age potentially. We can also use this method to question that, look at it to see how lesions may be changing over time and as they age. And so here's one case where this is a study that we did where we scanned people every month for 6 months to try and characterize acute changes that are happening in lesions. And so you have this lesion that appears at month 0, it's bright on the flare, and there's some enhancement on the T1. And by month 6, it's not quite gone, but it looks like it's getting smaller and maybe is on its way to going away. But then on the myelin water image, you can see that there's still this dark central void of myelin loss in the area where the lesion is, even still at month 6, which isn't really getting smaller in size and shape over the last couple of months. So here's a second example. Again, similar on the conventional image. And I should point out both of these cases are fairly newly diagnosed people, and neither of them are on therapy. So case 2 looks similar to case 1 in terms of the conventional scan. But on the myelin water image, you don't see a nearly, you see a little bit of reduction at month 0, which could be due to some edema dilution effects, but nothing nearly as dramatic as what we see in the first case. So again, highlighting the fact that you can get additional information than what you can get from the conventional scan. So I've talked a lot about lesions, but we can also use this technique to get information about what's happening in other areas of the white matter, so the more normal appearing white matter. And there's been quite a lot of work in this to show that the normal appearing white matter in multiple sclerosis is not normal, as the name would suggest. There are reductions in myelin throughout, not only in the lesions, but in other areas. And this is some work that was done at UBC by Dr. Shauna Abel, a PhD student that was with my colleague Shannon Coland, looking at changes in the normal appearing white matter in different regions and how those related to different cognitive tests. And so, for example, processing speed, which is in the top row, those areas that are highlighted were found to be important and correlated to impairment in different cognitive domains. We can also use this technique to look at spinal cord. Most of my talk is about brain, but I did want to highlight the fact that this method does work in spinal cord as well. And so this was some work done by Lisa Lee as a master's student, again, also working with my colleague Shannon at UBC, looking at cervical cord myelin water and the damage in that and how that relates to different functional tests in multiple sclerosis. So there's something called EDSS, which is a measure of disability, and then also 9-hole peg test, which is another kind of measure of motor function. And so Lisa found that there was strong correlations between myelin damage and how well the people performed on these various measures of disability. We can also use this method to monitor changes in therapy, monitor changes in myelin in response to therapy over time. And so we did one study, this is a 5-year study, looking at the evolution of myelin water fraction in the normal appearing white matter, so not the lesions, but the areas that appear normal. And so looking at controls first, so we found that they remained relatively stable. And then we had a group of patients that were not on any treatment, and they decreased on average by about 10% over the 5 years. There was one group, drug A, I don't want to name any drugs here necessarily, but people can go to the papers if they're interested, where there was a 4% increase in the amount of myelin over the 5 years, so relatively stable with some kind of increases at the end. And then there was a second drug where there was a 10% decrease over the same time course. So similar to what we saw in the people that weren't on any treatment. Finally, touching on the concept of creating normative brain atlases and how those might be used. So this was work done by my former PhD student, Kevin. And so he created a normative atlas using 50 healthy subjects, where essentially you get a bunch of healthy normal data and average it together. And then you can use that average or that atlas to compare individual patient data to. And so here is some examples of Z-score maps from 3 females, 25-year-old, with multiple sclerosis that looked very similar on the conventional scan with similar levels of disability. That's what the EDSS stands for. But then if you look at the Z-score maps, which are the middle and the bottom rows, you see quite a difference between how these people look on those maps. So the areas of blue are areas where there's more abnormal myelin, so reductions. And so you do see some variation in these patients. And this is a way that you can apply these methods at a single person level, as opposed to sort of a big group level. There's been other work at UBC as well by other students, Adam Dvorak, who works with, again, my colleague Shannon, and then also Sarah, who works with me, creating another adult large atlas, and then a pediatric atlas as well. And all of these are available freely for people to use. Likewise, with the spinal cord atlas that my student Kevin also created, similar concept, but this time in the cervical cord. And it's the same sort of approach where you can then take individual patient data and compare that to this normative atlas to highlight areas of damage and determine, what sort of changes might be happening at a single person level. So similar appearance for these 3 scans on the conventional anatomical image, but then the Z-score maps and highlighting the significant differences in the middle and far right row show differences in these people's myelin characteristics. So I did say I wanted to not only focus on MS. We've done a lot of MS, but I'm always excited to learn and see other applications of the Myelin water imaging method. So I did want to just briefly touch on those before I conclude. So ischemic stroke is something that occurs when there's a brain blood vessel that's blocked. It accounts for close to 90% of all strokes. And so this was a study done by Laura Boyd and colleagues at UBC comparing control to stroke normal appearing white matter. And what they found is that the people that had the stroke had a 14% reduction in global white matter loss of myelin. And so this is in the area that's away from the kind of central stroke, but the areas that appear more normal on conventional scans, suggesting there's diffuse myelin damage throughout the brain. There's another interesting study done by Alex Rauscher and colleagues at UBC looking at concussion. So they scanned varsity hockey athletes at the beginning of their season before they started playing. And this group of people have a more than kind of average chance of sustaining a concussion at some point during their playing season. And then when they did, they brought the people in for a scan as close to the concussion as possible at 2 weeks and at 2 months. And what they found was that at 2 weeks, there was reductions in the myelin water in the corpus callosum, as well as all throughout the white matter. But even at 2 months, while some people returned to normal levels, there was also some individuals that even at 2 months were still low. And at this point, people are back to playing their sport again. And so this may provide evidence to suggest that there's still ongoing damage that's happened to their brain, and maybe they wouldn't be ready to go back out onto the ice or field, whatever sport you're talking about. Another interesting study that we did quite recently, well, actually this data was collected a very long time ago, but was published recently, thank you to the COVID pandemic, where we mined a bunch of studies that we hadn't gotten to yet, comparing good readers and poor readers in children aged 10 to roughly 18 years old. And if you look at these images here, you can see even just visually, the good readers have higher amounts of myelin, so more bright yellow and bright green compared to the kids that were classified as poor readers. And then if we look at the relationships between reading ability and myelin, we found that for a number of different brain regions, there was significant relationships between different reading tests, so things like word ID and word attack, for the study cohort that we looked at. So we thought this was pretty interesting. And we're happy that we finally got around to analyzing this data and publishing it. So the last disease I wanted to just highlight was schizophrenia. So this is a disease that affects, it's quite common, 1% of the population, and it involves disordered thinking, delusions, and hallucinations, as well as many other symptoms. But unlike multiple sclerosis, there's no obvious areas of damage. Most people with MS, not everyone, but will show these bright lesions, but there's nothing like that in schizophrenia. So there's a control here and a person with schizophrenia, but you can't tell which is which from the conventional scans. So the hypothesis in this study was that the lack of functional cognitivity that's seen in people with schizophrenia could be due to reduced myelin, particularly in their frontal lobes. And so what they found was that on average, the people with schizophrenia had a 20% reduction in myelin in their frontal lobes and an overall 12% reduction in myelin throughout their global white matter. Another interesting finding that came from this study was that they looked at the relationship between frontal lobe myelin water and age, and saw that in the controls there was a significant relationship between those two measures, but this was not present in the people with schizophrenia. And then likewise, similar relationship for years of education compared to myelin water in the frontal white matter, which was also not present in the people with schizophrenia. And these controls were well matched to the schizophrenia group in terms of number of years of education, smoking history, sex, and various other demographics that were important for the study. So just to finish off on kind of looking forward, people are interested in myelin water. Students are trying to maybe think about what might be interesting areas to pursue. data collection is certainly something that's gotten faster and faster over the years since I've been involved in the technique. Back in the 90s, it took over 25 minutes to collect like one slice of data. And I think now, like, how did we get people to hold still for that long? But we did. But now you can do a whole brain in, less than 5 minutes. Another interesting area is data analysis. I really didn't touch on this, but with the explosion of AI and machine learning, there's been a large kind of move towards trying to incorporate these methods into doing the multi-exponential analysis to speed up the method, but also to try and be more robust and deal with things like noise. Large data application for sure. So I talked about the atlases. I think there's a lot of room for that. In terms of getting better demographics, larger age groups, education, sex, gender, ethnicity. There's a large, socioeconomic status. There's large things that could be incorporated there to help, and use this method for single patient studies. Of course, as with any technique, it's important to try and understand the limitations. There's been some work looking at the role of debris and also exchange and iron in a myelin water measure, but more work needs to be done. And then, of course, wide range of disease and normative applications from development all the way into aging and dementia, which, I think there's, and many more as well. So some final take-home messages about why myelin water might be something that people should consider if they're interested in measuring myelin. There seems to be quite a bit of evidence that suggests that the method is specific for myelin. There's many acquisition techniques available now, and so it is a technique that's possible on most systems. And I think this is really great because having all these different approaches will increase confidence in interpretation of findings. There's growing data in development, healthy aging and disease. And I think with the advent of these atlases and multi-center studies, there's lots more interesting work to come. I think it's very useful for understanding disease processes, watching areas of damage over time. Can we identify people that are inherently more likely to remyelinate and figure out what's maybe special about them and use that to help treat other people? It's important to think about, is the myelin functional? So there's been some, function tests that have been done in relation to myelin, but that, of course, is an important question to understand. And then can we predict who will respond to therapy based on somebody's myelin characteristics and tailor therapy that way? And of course, monitoring therapy. There's lots of neuroprotection and remyelination trials for MS and many other diseases. And I think this technique, as well as other quantitative MR techniques, will be useful for that. So with that, I'd like to just acknowledge the donors, the volunteers and family for all of the in vivo and postmortem work that I presented, various funding agencies listed on the slide there. And thank you all for your attention. I'd be happy to take any questions.
Okay, thank you very much, Dr. Laule. A very, very interesting talk. Aurélie, is there any questions in the chat?
Yes, actually, we have a few. So I will start with the first one, which was from Alexander Rocher. So he was saying you showed very nice MRI histology correlation studies with staining for myelin, which demonstrate the myelin water imaging, that myelin water imaging is sensitive to myelin. But how strongly is myelin water imaging influenced by other tissue properties such as water content, the angle between axons and the main magnetic field, or iron content?
Yeah, I mean, like I touched on in the very last slide, I didn't have time to go into all the various potential confounders. There are definitely confounders, like with any technique. In changes in water content, because the myelin water fraction is a ratio. So we're taking the myelin water signal from that short T2 component to the total water signal. Changes in the total water signal will, of course, cause reductions in the myelin water fraction, as with any ratio. There has been some modeling work to suggest that for the level of reductions that we see, for example, I'll use the normal appearing white matter in MS, where we see approximately a 15% reduction quite consistently across different studies, that for that reduction to be due to inflammation or just increases in water content alone and not decreases in myelin water content, the amount of extra water that would be needed is not physiologically possible, given that the brain would then need to swell that much. But of course, small changes in myelin water fraction can be attributed to increases in water content. Debris is another thing. So there's been some animal studies that show, this is an acute spinal cord injury. So that I think is at a period of 3 weeks, where the myelin debris hasn't been cleared yet by the macrophages. That still gives rise to myelin water signal, because the myelin is still, I guess, in some sort of bilayer form, which has water trapped inside of it, and that can give rise to signal. But that's gone by 8 weeks. I don't know if there's that much known about the time frame for clearance of debris in vivo in multiple sclerosis, but certainly I think we can learn about animal studies. And there's other things that are currently ongoing. Orientation effects is one thing that people are actively looking into. Does the orientation of the fiber relative to the main magnetic field impact the measures that we're getting? There is some interesting work at ISMRM this year, which is our big MRI conference, where somebody rotated, I think it was a rat brain. I might be wrong about that. It's a group in Vanderbilt, where they had some sort of preclinical rat or spinal cord brain, and they rotated in the magnetic field. They didn't see changes in the myelin water fraction, but then there's other in vivo work that's being done looking at the directions of the fiber relative to the field to see if that influences. So still a very hot, ongoing, interesting area. That was a long-winded answer, sorry.
Thank you so much. Okay, so the next question was from Jeffrey Brown-Dyke, sorry if I mispronounce. And he was asking, what software packages or publicly available code do you recommend for myelin water imaging, data processing, and analysis?
Yes, there are definitely publicly available software packages. One that comes to mind is DKs, which I can't give you like the exact reference off the top of my head, but the first author is Jonathan Doucette. If people are interested, they can email me and I can give you a link to that. So that is a publicly available one for people to use. There are other ones as well. And in terms of the atlases, maybe that wasn't part of the question, but I'll just plug it again. The atlases that I described, those are also all publicly available, so for people to use.
Amazing. So the next question was from Matthew Hoppan. Thanks for the excellent talk. Do proton density scans have a long enough T2 weighting to be used in myelin water computation?
Proton density scans alone? No. So you need to collect a number of different echoes. Some people, you may see some work in the literature where people try and characterize T2 based on just 2 time points, so like a proton density and a T2 weighted scan, and do a fit, like a 2-point T2 fit. So you definitely can't do that, and you need to have multiple echoes at multiple T2 times for the method that I described. I think the next speaker is going to be talking about a different approach to collecting myelin water data. So there are multiple ways of doing it. So yeah.
Okay. So we have about like 6 other questions, so I don't think we have time to ask them all right now, but we have a period of discussion at the end of the session, so I guess I will keep them for later.
Perfect. Thank you. Great.
Thank you so much.
Thank you. So yeah, I think we'll move on to the next speaker. Thanks a lot, Dr. Laule.